Well, hello everyone, and welcome to Talk of the Town with me, Lynn About Town, here in my town of sunny Clearwater, Florida. And I'm here today in studio with a wonderful, wonderful doctor, Dr. Vikki Petersen. Thank you for coming.
Oh, thank you so much for having me. It's a pleasure.
When Dr. Vikki talks about her clinic, she's talking about root cause medical. Now, when I hear that, I think, let's get to the root of the problem, or the root of the situation, or the root of those symptoms you're having. Because I think medicine has become a chasing of symptoms, if you will.
You know, that's very well said. The human body's ability to heal itself is pretty amazing. Most people don't realize, but research has very much documented the fact that your body parts, your organs, their life expectancy is 120 years.
What?
I know. And what's not okay is you have this ability, you know, this inherent ability to function for 120 years. And at age 60, we start our sort of big decline, and that's accepted. And so what root cause came about with is, you know, it's the respect of the human body saying, okay, we know you have the ability to heal, but you can get the body can get too burdened, you know, and then it can't do it on its own because, I mean, you get a cut, you don't really have to think about it, it heals, you know what I mean? So it's doing a lot of things you don't know that it's doing because of that inherent ability, but when there's too many obstacles, that's when it gives you the symptom. The symptom really is a cry for help saying, okay, too much on me, do something.
Do something. I mean?
Yeah. And conventional medicine is all about taking a symptom and managing the symptom with a medication.
Right.
And the underlying message there is, okay, body, you can't do it, so we're going to do it for you with a chemical that has side effects, that's temporary. And what I always say to patients, it's not very respectful. You know what I mean? You know, you come in, you know, as I said, with this chemical and it's got side effects and it's creating a trickle-down effect of other things. Often what happens is then, well, your blood pressure medication, it worked for a while. Now you need another one, you know, which is a way of saying you're not getting to the root cause. And I can't tell you how many people walk in or find us online and go, root cause, yep, that's what, you know, that's what I want, because I'm tired of this masking and this temporary measures and drugs that, you know, some people really read the insert and find out all those side effects and they're like, that's scary. Unfortunately, you have to be your own advocate, you know, because that model is not supportive of really regaining health and again, respect to the body. And it's amazing with the right help. So I tell patients, you know, we talk about doctors as healers, right? I said, I don't consider it that. I consider us obstacle removers. You know, like we just, you know, we just unburden, and then the body's like, oh, thank you very much, I got it. And it heals, you know? And so it's a beautiful thing to watch. As I like to tell patients, swallowing the pill is easy. Doing it naturally, you're working. You know what I mean? We're doing diet changes and we're doing lifestyle changes.
Yes.
So it's harder work, but then it's a done, you know? And at the end of a program, I call it having the care and feeding manual for your body.
It's not one pill for every person.
Right. At all.
No, at all. It's going to be some work involved, but you know, everything that's worthwhile requires a little bit of investment, right?
Yeah, I think so.
So what, if you could, like, talk about success rates?
Yeah, we've really looked at it. We've analyzed it several times over the years, including recently, and we're very proud that it's 85%. It's a really high success rate.
That's huge.
And then I always hold up my little index finger and I say, with compliance, because we're not magicians, you know. It's not like I have a magic wand. If I had one, I'd love it, but I don't. And so, you know, the patient has to follow recommendations. That's right. And as I said earlier, we really hold your hand through that, because it's not easy to change diet. It's not easy to change lifestyle. I always say to patients, you're going to fall off the horse. We're going to put you back on. Everybody falls off the horse. You know, don't beat yourself up about it. The good news is we're really good at this. The bad news is you're going to work for it.
Yes.
But back to the good news, we'll really hold your hand. And that I think is the other reason we're so successful is we really do hold people's hand. It's not like, oh, change your diet. Good luck. See you in 6 months.
Yeah.
No, this is, we have in the initial, we're seeing people weekly, because they're doing changes. How did that feel? What's happening? Tests are coming back. I always tell patients at the end of the program, it's not just that we like you swallow this pill and you go, okay, I'm better. I don't know why, but you know what I mean? It's like, because you're doing diet and lifestyle and you're learning, and this is several months of program, you leave with this care and feeding manual for your machine, and you're an adult, you can choose to throw it out the window because it's the holidays or your birthday or whatever, but at least you're in control. I'm like, right now you don't know how to make this symptom not be there, but you'll leave knowing how to keep yourself stable, or you'll be very knowledgeable on how to screw it up. But at least you'll know you're doing it, and you'll know how to
look,
get back.
the name of your Root Cause Medical, to me, who needs to be at cause with this?
Exactly.
It's you. Exactly. So it sounds like the whole way, your methodology is going to get the person more at cause.
Yeah.
To actually be in charge of the car they're driving around.
Yeah. And we just do a ton of education for that reason, because we don't want it to just be the superficial, they did this, they did that. It's like, no, we did this, Yeah. So we're at 1000 South Fort Harrison. Our website is rootcausemedicalclinics.com. And so when you go to the website, you'll see the different locations, California and Florida. We really are here to help. We do see all ages.
Thank you so much for coming.
My pleasure. Thank you.
It's been a pleasure.
Oh, good.